So when people come and see me for their back pain, usually the cause of their pain is one of three things. One, we typically see a bulging disc. Two, we could see some form of arthritis. And three, we could see some really tight muscles that surround the spine, causing pain and irritation. So when we look at a disc bulge, we always think of it as kind of like a water balloon. If you push down the water balloon, it should bulge out, and that's a normal thing. About 85% of the population is walking around with a bulging disc, but they have no symptoms. Now, here's the thing. If you take that water balloon and you push down on it really quick or really hard, it expands. And when it expands that quickly, it can stretch the fibers surrounding the actual disc, and that can cause pain. Now, with that being said, one thing we typically see with patients with disc bulges is that they do a lot of bending motions, like bending forward. So what we see with patients who have disc bulge is that if they bend forward, their disc bulge gets worse. But then if they do certain extension-based exercises, it goes away. So that's a big thing we do with a lot of our patients with bulging disc is we put them into extension-based movements, and they get really good results with that. Now, another thing we'll see patients is, again, with arthritis. When we get arthritis, it means the narrow spaces where the nerves glide in and out of become more narrow. So as a result, what we'll typically see is that with these little spaces where that nerve comes from, it tends to get a little bit more narrow. When it becomes more narrow, what we have to do is actually bend them forward. When we bend them forward, it opens up that space for them to allow that nerve more room to glide. So what we'll do with patients with arthritis is we'll tend to do flexion-based movements to make sure that their nerves get enough space to actually move and glide in between the joints. Last but not least, of course, is when we talk about tight muscles, we have a lot of muscles that surround the spine and they help stabilize the spine. Now, these muscles are called anticipatory muscles, which means that when they turn on before you actually move. So if you were to lift your leg up, your opposite muscles of your low back would kick on first to stabilize your low back. So how that's really important is whenever we move throughout the day, go from sitting to standing, those muscles would kick on. If those muscles are weak or tight, what happens is that they can't kick on as quickly as we would like them to, and over time that causes more friction in the spine, and that causes irritation and pain. So if you have any questions, feel free to ask me at your next appointment.